At the outset, really, I congratulate both the collaborators, that's Department of Bioresources, University of Kashmir, and J&K Science, Technology and Innovation Council, S&T Department, Government of J&K, UT. This program is being organized under the banner of Azadi Ka Amrit Mahotsav. That's the free breast cancer screening-cum-awareness program. My earlier speakers spoke about it. Believe me, personally, whenever, I'm very much concerned about any program, I say that it's very close to my heart. Similarly, awareness about breast cancer is very close to my heart because even I have witnessed around in my relationship, in our neighborhood, amongst my known, family members and many more suffering from this dreadful disease which could have been cured, but again, the awareness was not there. And when we say the awareness was not there, even amongst the educated females, this awareness is not there. As we see that more cases are happening or more cases are to be reported in urban areas than rural areas. So it's a matter of great concern. We at the University of Kashmir are committed. We are there to extend any type of support, whether it's research, from research point of view, from extension point of view, from advocacy point of view. I would request both Director Skims, Professor Parvez Kaul, and our Commissioner Secretary, DST. We should definitely, in a collaborative effort, try to reach to more masses. I am so happy that Dr. Manzoor and his team has made a commendable job for last 1 month. They have reached to 15 degree colleges of our other districts. I am sure the awareness which they have made over there will go a long way. As I have already committed that inshallah we'll try to organize an international conference on this issue next year. Let's see how we process on it. But believe me, awareness of this type is very important. I think it will be very good if we carry on this effort in a phased manner and in a continuous manner. We should not stop here. I was so happy to listen to the bites which have been documented to female teachers and female students of the respective colleges where this awareness camps have been made. See, even they had this concern that such type of awareness programs have not been conducted in their institutions so far. So you can see the importance. We should try to create that group, which we say, the awareness group or the trainer group. I'm sure Professor Parvez Kaulji will help us in this, where we can have a medical team from their institute. We can have own people from here, and to different colleges we can go and make awareness. It will be a really big service to our society if we are able to do it. Research we do, Skims does research, we do research. Professor Manzoor has got big research projects on cancer, which he does in his own lab. But this is something different. I really look forward to the Director Skims and his team to see how we can further work on these types of programs so that we really make awareness at the grassroots level, at the institutional level, at the high secondary school level, in more colleges, in our more satellite campuses, amongst more in our own female faculty, amongst our female students, so that really it makes a difference. And if somehow we are able to control the rising breast cancer rate in our own valley. I think it will be a commendable job, commendable service from both the institutions if we are able to do it. Even the central university has got a role to play. I think all universities have got a role to play. I definitely look forward if we can all collaborate together and try to make some change in the health system of our females. I see it a great concern, the way education is important for girls, the way the economic independence is economic for girls, for their empowerment. I think this is the main health concern, which is very important, and we should make our young girls aware at the proper age how they have to take care of their health, which is very important.
I'm really thankful to the Vice Chancellor after having known that the wonderful work you are doing in this area of breast awareness, and this one-day program, which is a mega awareness cum screening program, will go a long way in not only making aware this limited group of people, but also spreading this message across the Kashmir Valley. I would like to share, madam, that recently, last year, we were sent to South Korea, to study the health systems as bureaucrats. And one of the most significant programs that Korean government is doing, since they're at a very advanced stage in terms of demography, so gerontological support to the elderly people, and encouraging women to have babies and breastfeeding. This is one of the most significant programs of South Korean government, where they're spending the largest amount of money. Similarly, the Japanese government is also doing the same activity, because very few women choose to get married in Korea, and smaller number gets ready for having children, and breastfeeding is almost absent. So preventing women from smoking and encouraging them for breastfeeding is one of the major programs of Korean and Japanese governments. We are progressing as a society, and maybe another decade or 2 decades, we will be at that kind of a level of development. And they are also grappling with the breast cancer issue, as is the United States government also. What I would like to say here is that in a very detailed kind of a way, this website has been created. You have had awareness programs across various colleges, and these colleges are the places where children from remote areas come, whether we talk about remote areas like Tral or extremely remote areas of the state from Gurez, etc. These children can be the brand ambassadors. They can go to those remote areas, and as Parvesa mentioned, that the screening in the urban area is still better, but when you go to rural area, the screening level is still lower. Now we are also realizing that since I have been in the Kashmir Valley from almost 20 years now, so one phenomena that I have observed is that the age of marriage of women is gradually going ahead, and therefore women are getting married much later, and therefore childbirth is happening later. That is also predisposing the women to this kind of a problem. Obviously, use of contraceptives in a unsystematic manner and use of hormones is another issue. Dietary factor in the Kashmir Valley is very critical, because we consume a lot of red meat, and there is not a lot of balanced diet. Absence of greens in the food is also a very critical aspect. Then genetic factors can't be helped, but lifestyle factors can be modified, especially as we are urbanizing and we are getting, in terms of economic ladder, we are going higher. There is less of exercise. What an average Kashmiri woman would be walking or exercising maybe at 5 decades or 7 decades back, now almost a fraction of that is happening. So this is very critical. Another most important aspect that I would like to address is the shyness and the reason not to confront this issue. And I think the very fact we are talking here, we have talked to so many colleges, and Manzoor Saab has taken this cause to various remoter areas, and Vice Chancellor Madam is trying to now take it further by that international conference the next year. I think this is very critical. You can imagine 25% of all the women dying from cancers is from this particular cause. And the entire developed world, as Parvesa mentioned, that the diagnostic techniques and has become very refined in the Western countries. We are still diagnosing it very late, and because of our late diagnosis, so many important lives are lost. as all of you should know today, that it is not only the married women, even unmarried women are having this problem. Younger lot is also having the problem. So I think all of you basically have to take this message far and wide that this particular awareness has to be spread. You can also, it is also critical that in the government sector, as now we are shifting from the government-based medical diagnosis system to the Ayushman Bharat, and the insurance system is coming into our economy. So we need to have special packages in the government sector. This I am particularly addressing to Bhupinder ji, my colleague in the government, and also to SKIMS and GMC, that how do we handle breast cancer cases at various levels? Do the people get proper reimbursement through the insurance system? Because with Ayushman Bharat coming up, we need to have a system where the packages regarding breast cancer are developed. Not only the cure packages, but also the packages pertaining to diagnostics. I think that is an area where we need to work a lot. Another area I believe is the rural population, where we have to work on some special model of reaching out to the rural population. When I was recently the Labour and Employment Secretary, we bought a very big hospital to the valley, which is the ESIC hospital, which is coming up in Ompura. And in fact, I was very particular that a very high-end oncology department comes there. So that hospital is having 9 DMs, super specialities, and almost about 18 to 20, other departments. So, but again, we need doctors. So we have the infrastructure. Government is spending 300 crores on that hospital. I think it will complement the aims, and a lot of opportunity will be available to the people of Kashmir to access there, because the cost of treatment in the ESIC hospital is very minimal, almost negligible. And the referral system is so beautiful in ESIC that any amount, it's unlimited amount of referral. If a person is registered in ESIC and the treatment is 1 crore or 5 crores, he can be referred to anywhere in India. It is not like Ayushman Bharat where you have limited to only 5 lakhs per year, which is a very small amount when it comes to oncological care.
20 years back, breast cancer was possibly considered as the 4th most common cancers among all the cancers. But gradually it is picking up and it is taking over. And a recent study shows that it's possibly number 1 as far as the types of cancers are concerned. Not only this, 1 of every 28 women is likely to suffer from breast cancer. And as somebody said here, that every 4 minutes, 3 to 4 minutes, 1 woman in India is diagnosed of breast cancer. And every 10 to 12 minutes, 1 woman dies of breast cancer in India. The figures are really staggering. And if steps are not taken to prevent, at least slow down the incidence of this cancer, the time will come when all of us, God forbid, our nears and dears may be suffering from this deadly disease. Now, having said this, there's a positive, figure associated with this particular kind of cancer. That this is possibly the only cancer that is the highest rate of treatment and cure. The reason being that there are techniques which can be adopted by individuals, by women at their own level, and these help in the detection and diagnosis of this disease. But the thing is that we lack awareness. One figure says that in the advanced countries like US and England, US and UK, 90 to 95% breast cancer patients are cured. As compared to this good figure, in India it's around 60 to 65%. Why the numbers are so low as far as the treatment rates are concerned, the cure rates are concerned? Because of the delayed, late detection of this deadly disease. As compared to 1 centimeter lump, or what we call as tumor, That is the average size of a tumor that when it is detected in advanced countries like US, this is what stress data says. As compared to 1% this size, 1 centimeter size. The size of an average tumor when it is detected in India, breast cancer tumor, it's around 3.5 centimeters. And again, the reason is very clear, and that is the delayed detection. And what is at the root cause of this delayed detection is lack of awareness. The self-awareness, self-assessment, self-checks, or the checks by the medical professionals, by the health professionals, is at the bedrock of this, the prevention and cure of this disease. And I'm sure that the organizing of these events and launching of the awareness campaigns all across the Union Territory is a good step, a very good initiative taken by the Department of Bioresources, University of Kashmir. They've already, as was elaborated by the head of the department, Professor Manzoor Mir Saab, that they've already conducted numerous campuses across the Valley of Kashmir, including the colleges, and try to make people aware that prevention is better than cure.
Cancer, as we know, is an interplay of genetic factors and a lot of lifestyle and environmental factors. Genetic factors, there are multiple factors you possibly cannot change. You cannot help getting old, you cannot choose your parents, so your genes are carried along. So similarly, if you have a high-risk genetic profile, I'm very fond of saying that Kashmiris are Jews. Unfortunately, couldn't prove it by way of even detailed genetic testing. Still, I'm curious to know whether we are basically Jews or not. There is a lot of historical evidence to that. But that said, we have something in our race, in our ethnicity, age. Those are the factors that cannot be changed. But there are factors that can be changed. And I probably would slightly disagree with Dr. Manzoor. He said that breast cancer screening clinics should be made available in tertiary care hospitals. My take on that would be breast cancer clinics should be in every home. Every person should know how to palpate, do a BSC, what's called a breast self-examination. That is the clinic that is present in your home, and that has been found. Anybody who has been performing a regular screening of her own self has a lower chance of developing breast cancer or it getting detected earlier. So that is very important, that you have a chance of detecting your own abnormality yourself. And that is what is the aim of such programs. And these clinics should happen in every single home, which means that every single person, every single lady, every single girl should be actually sensitized that there is something that she can do to reduce the risk of her breast cancer. Another thing that we can do is that we know that breast cancer, they say that the age has come down. Mostly it used to be somewhere beyond 50 years of age. Basically, it is the total duration of your hormonal exposure of the breast tissue, which means that girls get menarche a bit at a lower age this time, and menopause is postponed. Anybody who gets the onset of her cycles prior to age 12 or menopause beyond 55 years of age, which means that there's a greater period of your body getting exposed to the estrogens. That is an additional risk for development of breast cancer. Your race is a possible factor. Your genetics is a factor. Somebody has a breast cancer in the family, you are at a risk. Somebody might have a male relative with breast cancer, you are at risk. Somebody has an ovarian cancer, pancreatic cancer, or even breast cancer in the family, you have a higher risk than others for breast cancer. But what can be done about this? These are unmodifiable factors. You can be active, You can take care of a weight. Overweight people are more prone to develop breast cancer compared to those who have a normal weight. You can avoid taking hormones because hormones add that added exposure to hormones. There is no direct link of use of oral contraceptives with development of breast cancer because they contain estrogens, the progestins as well. But oral contraceptives are best avoided if you can. And then, a reproductive history. Delaying pregnancy beyond 30 to 35 years of age is another factor that can be intervened. And post-pregnancy, we have fallen into habit of these Nestle, sponge sprays and Cerelacs and avoid breastfeeding. Those ladies who breastfeed their children have a lower risk of developing breast cancer than those who do not breastfeed their children. So there's a lot that we can do. There's a lot we cannot do. Genetics you cannot change. There are lots of unmodifiable factors, but there are factors that you can intervene in and we must. And in this regard, the most important factor that can help you intervene and reduce your risk of breast cancer is a breast self-examination. And that's where I said that these clinics have to open in the bedroom of every single girl. Every single person should have this clinic in her home with a mirror in front. That's all you need. And if you can do it, the program would have had its objective fulfilled.
As you know that across the globe, this month of October is celebrated as the Breast Cancer Awareness Month. And in this context, we know that the cancer cases across the globe are rising and there is an alarming rate about the breast cancer as well. In 2020 only, there has been almost 10 million deaths as per the statistics because of the breast cancer and because of the total overall cancers. And when we talk about the breast cancer, it has been the leading one. Almost 2.3 million cases have been only because of the breast cancer. And when we talk about the Indian context or the context of the Kashmir, when the statistics from the SKIMS, our own Sher Kashmir Institute of Medical Sciences came out, we know that there has been almost 20% rise in the cases of the cancer, which was alarming, 20% increase in 1 year just. So we at the University of Kashmir thought that we should also take a lead. We started in 2019 working on this, that what direction our research proposals should move on. So we started the triple negative breast cancer research work on that field, and since then we are trying to link up this with the societal setup, because we know that in our society there have been increasing the number of breast cancer cases, and we want to link it because awareness, first thing is that we should have the breast health education. If we have the breast health education, then there will be awareness among the people. Fortunate are we people because we have the smart gadgets along with us in our hands, and we have the information trickling down from all sources. But there are a good number of people who are living in rural areas, in far-off villages, which does not have this privilege of having those smart gadgets and information regarding this. What are the preventive strategies? What are the risk factors? What are the symptoms? So we thought that why not to go to doorsteps to them. And since last 2 years, the data has been coming that it was earlier thought that breast cancer is more prevalent in the old age people, especially after menopause. But once we compare the statistics which are coming since last 4-5 years, it is the age group of 20 to 30 or 30 to 40 where more number of people are being diagnosed with breast cancer. So we thought this vulnerable group of which is mostly in our colleges, from 20 to 30s, we thought why not to go to those colleges, to the doorsteps, to spread the word regarding this breast cancer awareness. And we chose almost 15 degree colleges across the breadth and length of the valley.
The University of Kashmir, which is the premier institute of the valley, and we are born quite early in 1948. And we have a responsibility to hand over the institutions surrounding our institute, and we are blessed that the University of Kashmir has a We almost have every educational institution near to us. We have NIT, we have SCOS here, we have Central University Kashmir, we have AIM Seconds here, and we have GMC very near. So our priority and our always we wish that we collaborate with each other and we carry forward the mission, particularly Honorable Vice Chancellor who has served in different capacity in the University of Kashmir. We believe in the extension activities of University of Kashmir, and fortunately the presence of University of Kashmir is almost in every nook and corner of the valley. We have a Kupwara campus, we have an Anantnag campus, we have Baramulla campus, we have here in Srinagar, we have 2 campuses. We have a campus at Gulmarg also, we have Jammu campus office also. So the presence of University of Kashmir is almost everywhere. And we have almost 200 affiliated colleges to the University of Kashmir. And to create awareness, which are whether any social issue which we face at present about the drug, particularly in Valley of Kashmir, or whether there are the health issues related to diabetics, related to the breast cancer or any other social or health issue, we have a great responsibility to shoulder. So, as already committed by my Honorable Vice Chancellor, that University of Kashmir is always there to extend every type of support to any educational institutions and the department within our university to any research and academic endeavor which anybody or which we want to do. And I congratulate Dr. Manzoor, who has done a commendable job, particularly in moving for the last 1 month to the different colleges of the valley for the awareness program. And I wish you all the best. God bless us all.